Okay, so the heart of addiction. I start almost all of my addictions courses with this because I think it really helps us just understand the basics of addiction, that people with addiction are addicted to changing the way that they feel. I remember hearing that from my mentor many, many years ago when I first was in my internship at an addictions treatment facility, saying the brain doesn't really care what causes the dopamine release, but people become addicted to changing how they feel. So we know that both drugs of abuse, including alcohol and cannabis, methamphetamines, nicotine, as well as behavioral addictions like gambling, gaming, sex, social media, food, all of these can change the way a person feels and can become an individual's primary means of emotion regulation. And that's where we start to see some of the compulsivity of addiction begin. So, why do drugs and certain behaviors feel good? I think just understanding a basic amount of neuroscience as it relates to addiction can be really helpful, not only for us to have empathy for our clients, but we can also provide neuroeducation. That when we can explain this to our clients and our clients' families, it can actually be so empowering. It really helps us move away from that moral model of addiction, that model that says addiction is a choice that people could stop at any time. And because they're not stopping, it must mean they have weak will or a character flaw or some sort of moral failing. We know that addiction is much better explained by the biopsychosocial model. So there are genetic factors, there are psychological risk factors, and there are social factors like availability and modeling. So it's much more complex. And I think if we can explain this neuroscience, that can help us move away from the moral model and fully embrace the complexity of addiction. So, I'm just going to give you a real short version here, but there's a lot more that we could say. I'm kind of just summarizing some bigger neuroscience, but we know that drugs of abuse and behavioral addictions activate a very particular part of the brain called the reward circuitry or reward pathway. So it's not in the prefrontal cortex, which is right in the front of the brain. This is the part of our brain that is involved with logic, with reason, with goal-oriented behavior. It's the part of the brain that helps us make decisions and really reason out and use a rational decision-making processes, pros and cons. That's all happening in the prefrontal cortex. Our reward circuitry is more primitive than that. It's in the midbrain. So if you kind of think between the ears, a little bit below the prefrontal cortex, we have the limbic system. Now, in the limbic system, there is the pathway of the neurotransmitter dopamine. So you've heard of dopamine before. This used to be called the pleasure neurotransmitter. Now we know there's more to it than that. It's not that simple. There's actually a lot of different components of reward, and dopamine is a part of that. It really has more to do with the wanting and desire of reward. But drugs of abuse and particular behaviors like gambling and gaming stimulate this very specific part of the brain, the reward circuitry in the limbic system. And it releases dopamine as well as other neurotransmitters that are implicated in reward. So feelings of pleasure, feelings of calm, feelings of euphoria, depending upon the neurotransmitters that are activated. So once an individual experiences this reward, our brains are actually very sophisticated and it pays attention to what stimulated dopamine release in the reward circuitry. And the brain remembers that was a pleasurable experience. I'm going to seek that out again. So individuals are motivated to seek out activities that are rewarding, that stimulate dopamine and other neurotransmitters implicated in the experience of reward. Scholl said rewards with stronger effects on dopamine neurons are likely to have more impact on learning and choices. So the brain learns what leads to dopamine release, and then we are motivated to seek that out. We make choices so that we can access those things that stimulate dopamine release. So drugs of abuse and these stimulating behaviors are extremely rewarding. They cause a lot of dopamine release. And so the brain remembers, and then we make choices to seek them out again. So drugs and certain behaviors feel good because they are activating our reward circuitry. And they are extremely reinforcing because of the neurochemicals that are activated by either the drugs or the engagement. Now, what's important for us to note is that over time, the brain adapts, and we call this neuroadaptations. Basically, neuroadaptations are any changes in the brain due to experience. So, if a person is using cocaine and has this mushroom cloud of dopamine that gets stimulated every time they use cocaine, the brain starts to recognize that's a lot of cocaine release. And so the brain responds by down regulating the natural dopamine production to try and deal with this stimulation of dopamine that's chronic. And then the person needs more and more of the drug or longer engagement in the behavior to achieve that desired effect. This is called tolerance. So tolerance, that one beer made an individual feel a certain level of pleasure and euphoria. Now it takes 2 beers to get to that same level. A person used to use pornography for an hour a day and achieve this degree of pleasure. Now they use for 2 hours a day. So the brain starts to adapt. So all of that to say, even though drugs of abuse and rewarding behaviors are pleasurable initially, they're very positively reinforcing upon initial engagement, that will change over time. And then individuals start using the substance just to not feel bad, to avoid withdrawal. And so even though it may start off as this feels really good, this is how I can get pleasure, over time that will change with the progression of addiction. So, drugs of abuse and behavioral addictions are both positively and negatively reinforcing. Positive reinforcement is simply adding something desirable, like the feeling of pleasure or the feeling of euphoria, to increase the odds of engaging in that behavior again in the future. So, this is just basic behaviorism, that if you reinforce something, it's likely to be repeated. That happens with drugs of abuse and behavioral addictions. They feel good, they're pleasurable because they activate the reward circuitry in the brain. And so they are positively reinforcing, but they're also negatively reinforcing. And this is really important for our discussion on trauma. So drugs of abuse and behavioral addictions are negatively reinforcing, meaning they're removing something undesirable to increase the odds of engaging in that behavior again in the future. So if when I drink alcohol, I no longer feel anxious, that's negative reinforcement. It's taking away something undesirable. If while I'm gaming, I'm not thinking about relational conflict or my depressive symptoms, that's negative reinforcement. So drugs of abuse and behavioral addictions are so powerful because they are both positively and negatively reinforcing. That negative reinforcement means that these drugs or these behaviors can provide a temporary escape from negative emotional experiences. And over time, individuals learn that drugs of abuse and behavioral addictions are very predictable. They're pretty reliable forms of emotion regulation, at least initially, before the neuroadaptations begin. So I want us to have that in mind as we talk about drugs of abuse, behavioral addictions, and trauma, that initially these addictive behaviors can really be a reliable way to change the way that a person feels.